This presentation is about generalized anxiety disorder. So, what is generalized anxiety disorder? We call it GAD, GAD. It's characterized by excessive, exaggerated anxiety and worry about everyday life events with no obvious reason for worry. People with symptoms of GAD tend to always expect disaster and can't stop worrying about health, money, family, work, or school. In people with GAD, the worry is often unrealistic or out of proportion for the situation. So, what this means is that, yes, it may be something going on to worry you, but you tend to worry bigger. So, you make it the situation a whole lot bigger than it actually is. Daily life becomes a constant state of worry, fear, and dread. Eventually, the anxiety dominates the person's thinking and it interferes with daily functioning, including work, school, social activities, and relationships. What are the symptoms of GAD? They include ongoing worry and tension, unrealistic view of problems, restlessness or feeling of being on edge, irritability, muscle tension, headaches, sweating, difficulty concentrating, nausea, the need to go to the bathroom frequently, tiredness, trouble falling or staying asleep, trembling, and being easily startled. So that means that you're jumpy. So, in addition to GAD, people often have other anxiety disorders, such as panic disorder, obsessive compulsive disorder, and phobias. They suffer from depression and will often try to self medicate by using drugs or alcohol. What causes GAD? The exact cause of GAD is not fully known, but a number of factors, including genetics, brain chemistry, and environmental stresses, appear to contribute to its development. So when we think about genetics, this is based on family history. And so if a person have a family member with GAD, they're more likely to develop GAD themselves. Once again, GAD is generalized anxiety disorder. Also, brain chemistry plays a role in the development of GAD, and it's based on abnormal levels of certain neurotransmitters in the brain. Now, the neurotransmitters are special chemical messengers that help move information from nerve cell to nerve cell. If the neurotransmitters are out of balance, messages can't get through the brain properly. This will alter the way the brain reacts to certain situations, leading to anxiety. So, what I want you to understand is that the brain cells communicate with each other and it sends out these chemicals so that your body can react and do certain things. Now, there's also some environmental factors that play a role in GAD. For example, trauma and stressful events, abuse, the death of a loved one, divorce, change in jobs or school may also lead to GAD. GAD also becomes worse during times of stress. So people will often try to take a substance, either medication or some other type of substance, trying not to feel bad. And these substances include alcohol, caffeine, and nicotine. Now they think that it's helping them, but alcohol, caffeine, and nicotine can make the situation worse. And if you are withdrawing from some type of addictive substance, then it can also be worse. How common is GAD? About 4 million adult Americans suffer from GAD during the course of a year. It's most likely to begin in childhood or adolescence, but it can begin in adulthood. It is more common in women than it is in men, but that doesn't mean that men cannot get it. It's just that more women have it versus more men. So how is it diagnosed? The symptoms are diagnosed by a doctor or some type of clinical professional who have studied in the area. For example, I am a therapist, so I've studied in the area so I can diagnose GAD. And we do this by asking you a series of questions. And if you're in your own physician's office, they may do a physical examination, taking your blood and everything just to make sure that your levels are what it needs to be. And based on the diagnoses from the doctor, then GAD is given to the person as a diagnostic label. And so what we want you to understand is GAD, if it's present for a period of at least 6 months and is interfering with your daily living, like for example, you're missing work or school, or you just don't feel, that you can relax, then it's time to speak with a physician and get medication so that you can begin to feel better and not worse by self-medicating on drugs or alcohol. And so it's treated with medication in a lot of situations. For example, benzodiazepines is one of the common forms of treatment. And also antidepressants. So when you think about some common benzodiazepines, you're thinking about Xanax, Librium, Valium, and Ativan. When you're thinking about antidepressants, then you're looking at Paxil, Efflexor, Prozac, Lexapro, and Zoloft. These are common medication therapies for the treatment of GAD, but also cognitive behavioral therapy is also used in treatment by therapists such as myself and other type of substance abuse counselors and mental health counselors. Also, psychiatric nurses will also use cognitive behavioral therapy. And what we're trying to do in this particular type of therapeutic approach is to change thought patterns that lead to anxious feelings. So we're trying to help you to not think about the negative things, but to think more so about the positive things. And we do not want your thinking to be distorted. We want you to look at worries more realistically. And so what that means is if it's something small and someone identifies it as, oh, that's a small thing, think that that's a small thing. And do not allow your mind to tell you it's larger than it actually is. And other things that is very, very helpful when you're in a state of GAD, generalized anxiety disorder, when you're feeling tension, relaxation techniques are very, very helpful, like deep breathing and what we call biofeedback, where you're learning how to control your muscle tension. So those are the treatments that's available. There are some side effects to the medication. For example, some of the side effects of the antidepressants include sleepiness, weight gain, and sexual problems. Also, you cannot take different types of benzodiazepines together because you run the risk of overdose. These medications have what we call half-lives, and this means that you may think that the medicine is okay to take together, but it actually is not. So you can prevent this gag from occurring by making sure you reduce the consumption of caffeine that is found in coffee, tea, and cola, and chocolate. You can also exercise daily and eat a balanced diet and practice stress management techniques such as yoga and meditation. Thank you, and that concludes the presentation.